Thank you. Other questions? We just have 5 minutes left. Yes. Sorry, did I miss somebody at the back there? Did I miss you? So can I let this lady go and then you? Thank you.
I had a broader question for the whole panel, I guess.
Can you put your mic on? Thanks.
Sorry,
And
my name is Rachel Pfeffer. I'm from the U.S. Food and Drug Administration. And my question is more aimed towards Allison, but really any of you who work with private sector partners could respond. I wanted to understand when P&G got involved in doing the clean, safe drinking water, initially you were looking at selling a product. So you invested in the innovation and such because you had a profit motive in there. But then how do you now build your business case and justify your kind of continued involvement in your sustained investment back to your manager, like your CEO and your board, since you're not making profits out of it? Like, how do you value those metrics, and whether it's your reputation, your brand, or those new partnerships you build? I'd be very interested to hear, or from any of you, like I said, who have experience related to that.
Sure, I can start with our experience. I think it's several of the things you mentioned and a few things that other people alluded to in the conversation with the panel this morning or this afternoon. We do have a very strong sense of, our ability to make an impact in touching and improving lives. And this particular program demonstrates our innovation. It inspires our employees. We have many new, I guess I'll call millennial employees, aging myself since I'm not in that group, who are very engaged both as interns or when they join the company, and many have come and said that this is a reason that they've joined Procter & Gamble, and they have quite an opportunity to select from a number of different, sectors. People who used to go into the private sector may be looking at opportunities through foundations or through, civil society and other opportunities. And so when they join our work, it's there's not too many of us who do this day to day, but it certainly inspires them for what they can, do in their contribution to the enterprise or the company in some of our other health-related or social impact programs. And so, one is definitely employee recruitment, retention, and inspiration is a key. Another one I think I mentioned was is learning about consumers in lower and middle income countries, where we're definitely operating, but in some we have a lot more to learn in new sectors because we have so many different categories of products. And so learning from our NGO partners, learning from the governments who, often water is a good example, they want to provide that as a basic right to people who live in their countries. And so together we learn about how to do that in a partnership, and it leads to other opportunities. And then I think the last piece is, we're trying to broaden the work that we do in countries through these relationship and partnerships with, many of the groups that are here. And we're looking at how do we take the lessons and the partnerships that have been built and the trust and the motivation to do more together and take that forward. And those are all things that they're not built overnight. They're not necessarily things that, someone just joining a private sector company would know or experience. So there's a real sense of value in this longer term sustainability focused effort that our smaller team has, and we're sort of a COE, I guess, or an internal consulting group that can help the rest of the company. So those are the things that may not look like exactly your typical ROI to a leadership team or board, but our current CEO is the one who greenlighted the project when we weren't going to achieve our commercial objectives, and he's back again now and still supportive of the effort that we continue to invest in. So I think it's that collection of contributions that makes it possible to keep the program going and scaling up to have more impact.
Yeah.
Roger Glass from NIH. I thought this session was very interesting because at NIH, while our prime target is research, can you hear me on this? Well, our prime goal is research for global and research here in global health. We actually have these wonderful partnerships, and I'm looking at Lauren with PEPFAR because we've been involved in the sustainability and capacity building through the MEPI and NEPI programs and beyond, and with the Gates Foundation because we've started regular meetings to build on the research that goes on at NIH with the delivery and the ability at Gates to move that forward. And Carol, with you, I think there's a lot of overlap, for instance, in our ethics programs and on our African Journals initiative, where we're trying to get a half a dozen African journals into Medline through partnerships with journal editors in the West. So I think that, I guess I'm looking at a public-public partnership, if you will, because I think that's almost as important in some of these interactions as the public-private partnership. And what we're bringing is either technical expertise or complementary activities, but there's a huge space in there as well. And I just didn't think that had been highlighted, but I did think it was another part of this woven fabric.
That's a very helpful point, actually, and maybe just as we wrap up, one of the thoughts that I've had since being able to participate in this whole forum is really what is the limitation around structuring this as public-private partnership. And certainly, you know, I'm bringing the PATH experience to this notion, but, you know, PATH has been partnering with the private sector for 40 years, but it's been very much in these transactional sort of technical partnerships. And what we've not done is bring it to the next level in terms of shared value and strategic alliance. And so our focus now is very much around that. And that doesn't actually sit, at least in the PATH terminology, as a public-private partnership. It may end up being that, but that's not the starting point for us. And so it's sort of interesting as I hear all these amazing partnerships, and the commonality across the panel is interesting, if maybe a little dull to the audience because you're hearing the same things over and over again, but the commonality is good. But I do wonder how far we restrict ourselves with the PPP and PDP model in not thinking more broadly about the opportunity, because clearly they're there and they're being taken advantage of as a starting point already. So I might, for the next panel with Jack this afternoon, and thinking about some of the challenges, leave us with that thought of how are we really constraining ourselves by thinking about this as purely PPP. Thank you all very much indeed.
Thank you very much, Elaine. Thank you, everybody. It was a really very interesting